Anna is a 32 years old G3P2 lady where her last pregnancy is a year ago, so she has a short gapping, all right, so she has this one and she's pregnant at about 8 weeks of gestation. So today is her first booking in the Klinik Kesihatan for her pregnancy. As we know in pregnancy, the iron requirement increase, and increase is a lot, okay, increase by a lot, about 9 times higher more. So that is WHO standard. All the women's ladies, regardless whether they are anemia or not, when they come in, when they first do the booking, they are started with hematinics. Yeah, that is why it is. So for her, we check a full blood count for her and realize that her HB is only 9.8. So she is now actually at the levels of this mild anemia. A lot of people didn't realize that IDA actually can bring a lot of complications in pregnancy. Especially for ladies, they would think that, wow, gestational hypertension, oh, gestational diabetes, hypothyroid, all these are very burning issue in pregnancy. Anemia, list in my list, right? Okay, so that is, they always have this myth and concept to know that anemia is nothing, okay? Just my HB low, I just feeling a little bit tired. Isn't all pregnancy all the same like this? No, actually there are a lot of complications that you can, the mother can experience if they're having IDA, where the mother, they can have preterm labor, maternal sepsis, cardiac failure. For baby, low birth weight baby, small for gestational age, and fetal growth retardations. And the impact of iron deficiency is not only on the fetus, it brings up to the childhood. Where this is our Malaysia data in 2022, it reveals that almost 50% of our children that is less than 5 years old are anemic. So this is very shocking and alarming. But why our children, so many of them are anemic? One of the main reasons behind it is because their mommy is also anemic. When they are baby, they are also anemic. That's why, you see. So, and we know that iron is very important actually for developing of the brain in the fundamental of neuronal processes like myelinations, energy, and neurotransmitter metabolisms. Okay, there are even some studies to show that there are associations with this anemia with neurodevelopmental disorder such as autism, ADHD. All right, okay, so there are some more studies to show us this evidence already. And what is most worrying is it can cause an intergenerational cycle of iron deficiency. Like I say, the mommy is anemic, right? So it borns a baby with anemia. And this baby will grow up to be an adolescent, adult with anemia, and become mommy again with anemia. So how we break the cycles is when all the mommy come to our Klinik Kesihatan, when all the mommy come for the antenatal checkup, isn't it? So this is the time where we pick them out and try to break the cycles so they can have a healthy baby, a healthy adolescence, and become a healthy adult. So Diana was started with oral iron tablets, but she complains of nauseating, abdominal discomfort, constipations. Yeah, I'm sure you heard a lot of this one. Okay, a very common side effect we face with the iron tablets. So she is not able to tolerate. And we know the compliance rate here is low, right? Okay, for the women's taking the tablets. Right, so this is how true it is. I always ask my patients when they come for follow-up. So, ada makan vitamin tak? Ada. Good, okay. Then you say, seminggu berapa kali lupa? 1, 2. Then you follow up with the questions. Ya ke? Oh, I like this word, ya ke. When you ask this ya ke, the truth come out. Actually, doctor, I tak berapa makan. Sebab, okay. So ladies, today you can go back home and try on your husband. You ask, have you do the housework today? Ya ke? Then you see the real answers will come out. Okay, so followed by the ya ke, you get the real things that they are the non-compliance that there is many reasons, okay, why the patient is non-compliance. And we did a study in my district, Kuala Langat district, okay, talking about the knowledge, attitudes, okay, and practice of women with anemia. And we found that actually, this attitude of tak apalah, okay, I don't care, anemia, the least of my problems, right? Okay, so a lot of them has this kind of the thought that anemia, nothing much, right? Okay, so this is important for us to correct their thinking. But the side effect itself actually is very real, right? The side effect of abdominal discomfort, constipations, all right, okay, the bloatiness is very real. So we still have to help our patients, okay, to handle this and to improve their tolerability, right? So how are we going to help them with to improve their tolerability? Well, if you reduce the elemental iron, yes, sure, indeed, okay, it can help with tolerability, but like we have said before, and also according to our perinatal care menu, yes, if you want to treat, you have to give a 100 mg dose, an elemental iron of 100 mg. That is for treatment. If you want a prophylaxis prevention, here you see prevention, yes, you can go with a lower dose, okay. But this lady, when they're anemic already, like Diana, this doesn't work for her. Okay, she needs about more than 100 mg of elemental iron, right? Okay, so how about eat with a meal, right? So you've got all these bloatiness, all these things when empty stomach when you're eating, okay, eat with meal, yes, indeed, it can help. But like we say, only 10%, okay, of the elemental iron was absorbed in our gut. If you eat with the meal, the absorption was even worse, right? So it's very hard for us to balance this, between these two. How about reduce the dose to every other day? Yeah, this is one of the practice I see in some, yes, that they suggest that, okay, since you cannot take every day, why don't we take every alternate day? Because instead that they're thinking that it can maximize the iron absorptions, it can make the dose more efficiency, all right, okay, increase the tolerability, and most important, what? Save money lah, right? Okay, but is it really true that some studies to say that it can help, but no, all right. Remember what we say about the hepcidins just now? Yes, hepcidin is the one of the hormone that helps with the iron regulating, right? Okay, in hepcidins, right, in IDA patients and in pregnant women, our hepcidins has been low. So some, when they are very worried that if you keep on giving the daily high dose, right, you might increase the hepcidins. No, that is actually not very true. Because in IDA patients, and even in pregnant lady, physiologically, the hepcidin has been suppressed. Right? So in iron deficiency anemia, where the iron stores are exhausted, the hepcidin level has been suppressed, right? To physiologically increase the erythropoiesis and circulating iron level. That is the same with the pregnant lady, right? So when the hepcidin level is low already, you don't need to worry about whether these daily maximums of 100 mg of elemental ions will cause the side effects or not. No, all right? So you should give the daily dosing of high iron dose. Okay. So stop worrying about this hepcidin issue. We should give them a daily therapeutic of 100 mg ions. All right. And how about we change to a formula that can reduce the irritations to the gastric, right? If we are using the sustained release ferrous formulations, it gives us, the study has shown that it gives a lowest incidence of gastrointestinal adverse effect. And you are choosing the Iberate, it has a very smart, what we call a GranuMed technology, where the pills itself is coated with the vitamins. So when it goes to your gastric, the vitamin is released in the gastric, right, which help with the absorptions. And the true site of iron absorptions actually is in the duodenum. So it comes to a place where the maximum absorptions happen. So this very smart GranuMed technology, not only it reduces the side effect, which is like the gastric irritations all happen in the gastric, but also it helps with the absorptions of the iron, increase the absorptions of the iron. Right, so this is one of the preparations that you can consider when you want to give the patients. So Diana was given this sustained release formula and advised to take before the bed, and her symptoms improved, and she continues to take her iron therapy throughout the pregnancy. All right, so I'm coming to my last case, where it's a case scenario 3, where Mrs. Wong is a 63-year-old lady, where she's menopause for 15 years, and she complained of feeling giddiness on and off, And she also felt breathless when she climbs up the stairs, walked for a longer distance. So this is some vague symptoms here there. But she denied any history of ischemic heart disease. But she complained occasionally she's having constipation, abdominal discomfort, has no family history of colorectal cancer. So we did a full blood count for her. Yes, her HB is low. Her MCV and MCHC also is low, so she is having a microcytic anemia. So this is something that is very important to remember from my today's talk. Anemia is a warning sign for malignancy for men and postmenopausal women. So I repeat, anemia is a warning sign for malignancy for men and postmenopausal women. So that is from a lot of survey, and even from Malaysia survey, that we know that iron deficiency anemia and rectal bleeding is one of the very important predictors for colorectal cancer. So if you are seeing any men, okay, that came in to tell you that they are anemia, all right, it's not enough just to tell them to take the iron pills. We have to investigate the underlying cause. Why he is anemic? What is the cause of his anemia? Same to goes with postmenopausal lady, because they are no more losing through the menses, right? Okay, so why are they anemia? So we cannot just stop there by giving them the hematinics. We need to investigate and see what is really the underlying cause there. And one of the things that the alarm should ring in your bell is colorectal cancer. So we sent her for a colonoscope and discovered that actually she has a bleeding polyps, and it's a tubular, luckily for her, it's an adenoma, and she done a surveillance colonoscope yearly. Right, so this is my last slide, bring to work message, and think of the possibility of anemia when the patient's presented with a related symptoms. We don't stop there, we want to investigate for what might be the underlying cause of anemia. Is it the IDA? But due to what? All right, or is it other thing else? All right, so IDA is the commonest cause of anemia in Malaysia, but we should always look for the cause and beware of the warning sign. And remember, when we want to treat anemia, we must give them the therapeutic dose, which is elemental iron more than 100 mg, to be efficiently treated them. Okay. All right, so thank you very much.
Thank you, Dr. Tan. Very nicely put. I think very nicely you have actually described in a very simple way to understand with a very important topic, anemia, I think, for everyone. And the cases also, you have different type of ladies from different age group, yeah? So we have a lot of questions from the floor. Okay, let's just start. Okay, so about a pregnant lady. Yeah, a pregnant lady still needs to push up the HB count, okay? Combination of additional folic acid, 800 mcg, and ascorbic acid, vitamin C, 500 mg, in combination with Iberate offer can give benefits?
Iberate itself is already got the folic acid and the vitamin C.
Yeah,
all right, so you don't really need to top up for that. So that's why I say it's a one pills for all. You can save some of the money on the folic acid, the extra of folic acid and vitamin C. You don't really need to top up for that.
I also saw just now the latest formulation, the vitamin C is all at the coating parts, you know, and then the iron is inside. I think the formulation also causes less GI trouble, I think.
And it helps with the absorption, because vitamin C helps with the iron absorption.
Okay, so one single pill is sufficient, all right? Okay, going on. Doctor, what's the recommended dose for thalassemia carrier pregnant lady, as too much ferrum is not recommended as they are unable to absorb?
So this is talking about thalassemia carrier lady, all right, where too much ferrous, okay, the iron might not be recommended as they are unable to absorb. Okay, so I got a lot of thalassemia carrier, all right, which in combinations they have iron deficiency, right? So like I say, you have to find out the cause of the low HB. So a lot of the thalassemia lady, when they come for booking, maybe their HB is about 11, okay? Some of them very good one is around 11, but in combinations of that, they might have iron deficiency anemia. That's why I still do an iron study for them. So if I see their ferritin is low, that means it's anything less than 30 is considered as an IDA, right? They still need because they have combinations. And I know a lot of people are worried about, oh, will they get iron overload, right? Okay, because it's thalassemia patients. Right? No, it's if you are following the therapeutic dose, right, of 100 mg per day, right, and they don't easily get overdose lah, unless this patient has other things like the chronic liver disease or others. So you don't really need to worry about this overdose issue.
Okay. I think as what you mentioned, important parameter is ferritin because it reflects the storage, right? The iron
Yes,
storage.
correct.
I think it's good to do the iron study as well.
Yeah,
Not
yes.
just refer the HB alone. Huh?
Yes, correct. So we always want to find out actually what is the cause of the low HB.
Good. And okay, PPI and iron are both suggested to take at empty stomach, but PPI reduce the absorption of iron. How should we address this issue?
Don't take together lah,
Yeah,
right? There are so many hours in the day that you can take, so why you want to take together, right?
Yeah.
Okay lah. Some of the patients, yeah, okay, when they really have very bad these side effects of iron tablets, sometimes we advise them can take at the night time before they go to bed. So sometimes it do helps. Some of my patients, it do helps with them.
So split the timing. Now it's very, very flexible. We can actually advise them. Okay. In what situation a pregnant lady is needed to take double dose than the usual dose?
Okay, if you according to perinatal care menu and if you according to the KKM Blue Book, right, the dose written there is 1 tablet per day. Okay, but I do practice double in some cases where I need the ladies to push out, especially for pregnancy lah. There is urgency that we need to push them out, okay, before they go deliver to reach a certain level. All right, so I do give them, but only for a short period of time. I give 2 iberates, okay, maybe for about 2 weeks. Because I don't want to overburden their hepcidins also, right? So I practice about, I give them for a short course of time, just for the period to push out their HB. Maybe about in the 35 to 36 week that time, if they haven't achieved their desired HB before they go for delivery.
So you use double. So I just want to add on to that. I'd like to ask whether if, let's say, you can't really wait, and is there any instance where you also have to go to IV?
Yes, we do practice.
Sometimes you don't have
for,
time.
For those ladies who you know their iron store is really low, okay, ferritin like 5, 6 just now, okay, where they are already in the 3rd trimester, 30 weeks and above, okay, you know it takes time, now their HB is only 9, okay, so yes, we do give them IV. Actually, we give them quite often also in my clinic.
Yeah, depends on the urgency, right? Okay. Okay. How long will it take to see the HB increase by 1 gram after supplement with elemental iron 100 mg?
2 weeks, 2 to 4 weeks, you should be able to see. Yeah, if the patient is compliant. If it doesn't increase, then you have to check back what's wrong with that. Yeah.
Whether they take every day or not, huh? Okay. I like the year curve.
Yeah.
Because as a pharmacist, I also in MTech, sometimes they ask, very nicely they can give a short answer, but you dig further, you know the real truth. So you have to talk to them. They already prepare a standard answer before they come. Okay. Okay, now this is about Ryle's tube. If a patient is on Ryle's tube feeding, is vitamin C still necessary for helping iron absorption?
Yes, it do.
Yeah.
It still does, okay? Because the rice tube also is still goes to the gastric part. Yes, it still help with the absorptions.
Yeah, correct. Because you still need to absorb. It's just a method of delivering
administrations. Yep.
Yeah. Okay. Should women who are planning for pregnancy start taking iron right before at the preconception area?
Yes, I think we should, because like I say, the prevalence of anemia is very high. And a lot of women, they didn't come to any medical attentions until they are pregnant. So for the past maybe 20, 30 years, they never see any doctors. They don't even know that whether they are thalassemia or they are anemia or IDA or what. Right, so we should prepare the women before they get pregnant.
So for those people, I think they can take the prophylactic dose because they are not confirmed.
If they known case that they are anemic already, then they should take the treatment dose. Yeah, if they didn't know, yes, then they can take the prophylaxis
dose. They're just simply taking,
Yeah, but like I say, a full blood count is a very easy, simple test to get done to know your HB status.
Yeah, okay. Okay, this is from one of the pharmacies. I have a patient on Vizan for 5 months now and still experiencing spotting. Should she continue taking iron supplements until the spotting stops?
I don't think it has to do with the spottings.
Yeah,
So
yeah.
yeah, it doesn't, the side
Yeah.
effects is not the spotting. So I think she can still continue with the iron. Yep.
Okay. So we have come to the last question. Uh, if hemoglobin is normal but ferritin is low, is it considered iron deficiency anemia?
Ferritin is low. This is what we call the iron storage depletions already. So these patients will become anemia. This is like, you know what, this is the saving account already very low already. Okay, you still have some money in your wallet. Yeah, is this person considered poor? Poor already, right?
Yeah lah.
Yeah, okay. So these patients can go into the anemia anytime soon. That's why we say that in treatments of anemia, right, you don't stop there when the HP rise up, right? So when even people are very happy when they see the HP, oh, rise to 12 already, okay, tak payah makan anymore. No, you don't stop there. You want to replenish their iron stores. So for all the anemia patients, I will continue that treatment at least for 6 months. So to replenish the iron stores. If you stop immediately after the HP increase, maybe 1 or 2 months, right, very soon they will go into this anemia state again.
Very good.
Yeah.
She's using the bank deposit, and that analogy is very, very useful because you're right. For a while it's okay, but the store is very little. There's a high tendency for it to come down again, right? So it's good for them to, if they found the ferritin is low, they can supplement themselves and
Yeah.
continue. So I'm sure all of you agree. It has been a very interesting session, very nice session on anemia. Let us thank Dr. Tan for a wonderful session.